Let's move now to focus on our vaccine drive. And Deputy President David Mabuza wants at least 40 million South Africans vaccinated by the end of the year. He was on a vaccination push in Kagiso today. The area west of Johannesburg has seen quite a low uptake of vaccines. Reporter Govan Whittles tracking the story and joining us live. Hello, Govan. So obviously he was there to spread the message about vaccines, to encourage people. Give me a sense of how he engaged with people. Was he very relaxed, very friendly? Did he give big speeches?
Well, the Deputy President did appear to be in his element today. First time back on the street since he returned from Russia, and he appeared to be having a lot of fun talking to people. But it did look like the main reason, or what he was really trying to stress to people, was to combat this fake news narrative and to try to get them to register, seemingly very aware of the low uptake on registrations in the West Rand and Kagiso. Only 8% of the population has registered for the vaccine or received the jab. So they were trying to go there to not only speak to the community directly about some of the stories they've heard about the vaccine, but also to try and get them on side to encourage others to go and get the jab. And it was an opportunity for us to ask him how he feels about being back into the country. The Deputy President saying he's happy to be back, and perhaps as a response to some of the criticism about whether or not he's healthy and still able to lead in that capacity as Deputy President of the country. Mr. David Mabuza saying that as long as he's able to, he will do his best to lead and assist South Africans where he can. But this outreach in Kagiso also marked a change of strategy for the government, Sally, where they're saying that most of their focus will not just be on setting up vaccination sites in different parts of the country, but trying to get the vaccines to the people, not only through the vaccination pop-up sites at malls, at taxi ranks, but also, as we saw today, through mobile units that are essentially going street to street, following the community workers who are going door to door and trying to get those vaccines to as many people as possible, as soon as possible. And let's listen to what the Deputy President had to say about their attempt to meet this target of 40 million vaccines by the end of December, which he says they won't revise. Let's take a look.
We're no longer going to wait here at the vaccination sites. We are going to take the vaccine to our people. Some are reluctant, some they're having fake news, rumors about the vaccine. So we explain to our people that no, the vaccine is something that will help them, not something that will kill them.
Really important messages. So he wants to see 40 million adults vaccinated by the end of the year. So far, I think we've got 6 million fully vaccinated adults. So there's quite a long way to go in the next few months. And then, of course, concerns about this new variant or this new lineage of COVID-19, C12. He also spoke about that a little. What did he say?
He did address this quite directly and asked whether or not South Africans need to be concerned or whether there's a need for further restrictions to be placed on the country following the outbreak of this variant, which has been detected in South Africa. The Deputy President attempted to, in a manner, allay fears and play it down a little. Sally, let's have a look at what he had to say about how this new variant affects their plan to fight COVID.
For now, nothing to worry about the new variant. It's still under control. If we feel that this new variant is now a problem, the Minister of Health will announce and how best we want to deal with it. But for now, we're tracking it.
Yeah, absolutely. We're just keeping an eye on it. I think it makes up less than 2% of infections at the moment. But as we've learned with this virus, we always have to be on our toes, keeping an eye. And it's great that we are sequencing this virus so regularly to see how it is mutating so we can adapt and move. Govan Whittles, thank you so much for that update from the Deputy President. I have to say, you can't see much with a mask on, but he certainly did look quite healthy, the Deputy President. That is good to know, because we know he's had health troubles.